My name is Tammy Reed, and I am the Outreach and Communication Coordinator for the Healthcare Leadership and Administration Program.
And Tammy, we want to record this, right?
It should be recording.
Is it?
It is
Yes,
recording.
it is. Yep.
Okay, very good.
Thank you.
My name, yeah, and I just wanted to double check. So my name is Dr. Kim Radke, and I'm the undergraduate program director for the Healthcare Leadership and Administration Program. We want to thank Caitlin Junk and all of the students in the Medical Administrative Professionals Program, hopefully I got that correct, for earning their Associate of Applied Science degree. And so our goal for the next maybe 10, 15 minutes is to simply share some information about a bachelor completion option that really tag teams up with your associate's degree. And so students kind of follow that path. If you're trying to earn an associate's degree in maybe 2 years on average, it might take you to earn that degree. It allows you to jump right in and start working in a healthcare setting so you can earn money. And the bachelor completion program with Winona State University allows individuals that are working maybe 30 to 40 hours a week to continue to earn a Bachelor of Applied Science in Healthcare Leadership and Administration. So the goal over the next 10 minutes, 15 minutes is just to give you maybe an overview of what that might look like for those that might be interested. Again, sometimes when you're just going to school, you can only see past, I just want to get through this 2-year program and start earning money. But 5 years down the road, you might be working in a healthcare setting thinking, wow, I would really like to advance in my professional career. What would that look like? So this is one option that students that are working in a healthcare setting. It allows you to maybe move up into a lead supervisory role, maybe a managerial role. And so earning that Bachelor of Applied Science, a lot of hospitals, one of the requirements is to have that Bachelor of Science degree to move up into a management position. And so we're just going to share over the next few slides what that might look like. And then I'll let Tammy take it from here.
Okay, so first of all, why Winona State? Why should you choose Winona State? Well, we have an articulation agreement with Western Tech for your program, so we know how your credits would transfer in. So that makes it a nice, really easy, seamless entry for you. Winona State offers a lot of scholarships. Let's see, over 700 scholarships each year that total more than $1.4 million. We just did some scholarship reviews recently, and we didn't even have a lot of people apply, so definitely apply for those. Rolling admissions, so you can start our program in August, you can start it in January, or you can start it over the summer. So it's really flexible that way. We have really small class sizes with supportive staff and faculty. Our average class size is 19 to 1. We are a military-friendly institution. We have affordable tuition. We were just rated as the most affordable Minnesota State college recently. And we have an excellent academic reputation. Here's some of our awards that we've been bragging about lately. We do have the #1 student success rate. We have a 97% placement rate for our graduates. I went to school at Winona State for my undergrad and my grad. I am a warrior for life. It's a great place to go to school.
And so our program started in 2013. And I always say the pioneers that started this program were very visionary, forward-thinking leaders because they designed the program with the end in mind, meaning that you're very busy, you're an adult learner. The average age, I think when we looked at the average age of our students, is probably in the upper 20s into their 30s. So these are individuals that have worked in healthcare for a while. And again, they're looking to advance their degree. They usually have a 2-year degree in some healthcare related field. So the medical administrative professionals degree gives you that healthcare experience. That's one of the requirements for our program. And again, it's flexible, it's fully online, and it's asynchronous. There are a few synchronous meetings in certain classes, and those are listed in the syllabus. And really our curriculum is really focused on healthcare leadership and administration. So we have some outcome areas that we are looking at. And the first one is leadership and critical thinking. So that really focuses on developing emotional intelligence and focusing on the leadership skills needed to work in those roles. We focus on communication and relationship management, professionalism and knowledge of the healthcare environment, as well as business skills and knowledge.
Okay, we also actually have a master's program, so I'm just going to tell you a little bit about that here. So over on the left here, you can see this is where you're at right now, right? You're earning your associate's degree. Um, and while you're earning your associate's degree, one of the things that you could do to level up while you're there is to take some of the general education requirements. Um, and those are kind of built into your program that you have there. And if you work with Caitlin, she can help you, choose some good gen eds that will transfer nicely to Winona State. Um, when you think about coming into the program, you might wonder, oh, what's going to transfer? Well, you're going to be able to transfer 30 technical credits. You're going to be able to transfer any upper division elective credits that you have and any general education goal areas that you have that you'll be able to bring in. And all of that is written into the articulation. So Caitlin would help you be able to help you choose good gen eds to take to save a little money before you come to Winona State. And then in the middle here is our Healthcare Leadership Bachelor of Applied Science. This program takes 2 to 3 years to complete. It's completely online. It's a flexible schedule to meet the demands of busy working adults like yourself. While you're in this program, you can actually take 9 credits that you could take at the graduate level, and they would count towards both your undergrad degree and your graduate degree, should you choose to go on to that. You take a look at the bottom here, you can see how your salary goes up with each, on average, with each bump up in education. And so if you're thinking about getting your master's degree, you could think about that. Accelerated pathway to the master's degree. If you were to do that, you would only have an additional 25 credits to get your master's degree, which would be a nice bump in, opportunity, a bump in your salary likely, and just a faster way to get there. So it only takes about 4 semesters after your bachelor's degree, if that's something that you're thinking about. And again, you might not be thinking about this now. Maybe you think about this in 5 years. And that's all still, relevant at that time. Your credits will still count in the same way. You'll still be able to bring all of that in. And so it is a great way to leverage your learning and maximize your earnings. This slide just tries to give you a little bit of an idea of how the bachelor's degree is comprised. So you have the technical credits, which you're earning now at Western Tech. And then the min-tech area, this is like your general education requirements, that all universities have these. And then your upper division completion courses, and that's the actual healthcare leadership and administration program courses. And whatever, even though we have an articulation agreement, when you come to us, if you come to us, we sit down and look at all of the credits that you have, and we make sure that you get all the credit that you can brought in. We have a really great advisor who's really good at looking through the details of your transcript and making sure that you get credit for everything. So, maybe you already have your Associate of Arts or something else, you can bring those credits into, and we're going to make sure that you get as much credit as possible for those so that you have a personalized plan of study for the most efficient path to graduation. This probably looks familiar to you. This is, your 2-year plan for your medical administrative professional program. What I want to point out here is that there's some courses that you're taking there that are going to directly come into the HLA program. And so you won't have to take those courses with us. The courses that have the purple after them, these are meeting some of your elective credits here, and then down here, like your medical law, ethics, and professionalism course, that's going to come in as one of our courses. We do have some recommendations. So if you are thinking about this program and you want to start planning early, you could think about taking some of these gen eds that are listed here to help you, get ready for that bachelor's degree down the road.
is an example of the curriculum through the Healthcare Leadership and Administration Bachelor of Applied Science program. Again, this is a 2-year outline of what the courses would look like, taking on average 9 credits a semester. We do have some students that, life is really busy and maybe they only want to take 6 credits a semester, and that would probably take you about 3 years to get through the program. So again, we try and meet you where you're at. So again, we have an introduction to foundations for healthcare professionals. We have a wide variety of different healthcare leadership and administration courses that are focused on those, again, key outcome areas that achieve those competencies by the time you're done. Tammy pointed out, there's certain courses that you take that we actually count as elective. So when you take that medical office practicum, we bring that in as a 3-credit elective. You already take medical law and ethics and professions. I'm not sure exactly what the term they use, but it's a 2-credit, and we gave you credit for that healthcare law and ethics, so you don't have to take that course through our curriculum. You also have the business correspondence for healthcare, which we bring in as an elective, and you take a team building and problem solving. So then that removes another course that you don't have to take. So we're trying to, again, kind of like couponing or double dipping, if you will. So we try and give you credit where courses that are equivalent to some of the courses that we currently offer. I'd also like to point out the undergrad to grad option, and maybe that's way beyond where you can process that right now. But a lot of our students, when they get into our program, they realize that, if I can do this Bachelor of Applied Science, you can actually take 3 of our courses at the graduate level that count toward not only the Bachelor of Applied Science, but they also count toward earning a Master of Science. And again, that just helps advance your profession in the healthcare leadership and administration world. According to the Bureau of Labor and Statistics, this field is expected to grow by 28% in the next 5 to 10 years. And I guess we can thank the baby boomers for that. We call it the silver tsunami of individuals that are retiring, which creates a lot of shifting in healthcare. So these individuals were probably in these managerial roles. When they retire, they're looking to fill these positions. So the classes that you could consider taking in that undergrad to grad course include HLA 444, which is Introduction to Change Leadership, the Healthcare Policy, HLA 414, and the last one is HLA 452, which is Financial Resource Management. Those 3 courses, you could opt to take the 500 level graduate course, and that actually is 9 credits that would count, again, not only toward your Bachelor of Applied Science, but if you go to the next slide, that would actually count toward earning your Master of Science. And we call that kind of the Accelerated Master of Science in Healthcare Leadership. Again, the average income with a Bachelor of Applied Science is probably about $75,000 to $80,000. Once you grow, and it kind of allows you to move up into those more of the director, the administrative roles in a healthcare setting. And that's where you're probably looking at closer to 6 figures plus in those leadership roles once you earn a Master of Science. So it really helps advance your professional degree. It really allows you to get paid what you feel like you deserve. And so this is a program, again, that takes on average between 4 to 5 semesters once you've completed that Bachelor of Applied Science degree.
And you don't have to make any decisions about that right away. You could start the program, get to know the faculty, get a chance to talk with the graduate director before you ever had to make any decisions like that. It seems like a lot, but really when you take it step by step, it's kind of like bite-sized chunks as you go along. The program is, as we've already mentioned, completely online. It's usually 50 credits, but for you all, it would only be 39 credits. So the estimated tuition is about 15,000. It would take 2 to 3 years, depending on how many courses you wanted to take per semester. Admission requirements, as long as you complete the program that you're in currently, you are going to be able to fulfill all of these requirements easily. You need to have the 45 credits. You need to complete the communications requirement. So this is like your kind of standard beginning writing class. You need to have a GPA of 2.0 or above. You need to have your associate's degree, your Associate of Applied Science that you will have. We will have you complete a little application that we require, which is short and very easy. And then you need to be working in a healthcare related field, either currently or previous. It's a really good idea to be currently working in it because you're able to bring your work to your class and bring your class into your work. And we hear from students all the time that their supervisors see what they're doing in their classes. They see how they're able to apply these skills. And, they recognize them and they see them as ways for them to move up. They want their employees to move up when they see the skills that they're building. And so it's great to get that experience while you're taking the courses because it kind of doubles up on your benefits.
This slide really talks about testimonials from our alumni. And so some of the things that they have stated once they've graduated is that the faculty and staff are very supportive. We want you to succeed. And like Tammy said, the supervisors are recognizing those leadership skill sets. We give you projects that are healthcare related that help you grow professionally. And we have really, when you get into the program, you do work in groups in some of the classes, so you get to know your classmates kind of in a cohort style that allows you to get to know your classmates on a personal level. Again, we pride ourselves on offering a supportable, a high quality education in a supportive and affordable environment. And our students have said they feel prepared to work in a healthcare leadership and administration role. And they also feel prepared to, and they build up that confidence that they believe that they can go and earn that Master of Science in Healthcare Leadership. And the last slide, I'd like to brag on just the success coaches. So we have some amazing success coaches that help with the onboarding and admissions. Again, we talked about Barb Nassick. She's worked at Winona State for 15 years. I would call her a master advisor. If you want to try and expedite your Bachelor of Applied Science, again, she teaches you how to double dip with any classes and kind of coupon and maximize the classes that you've taken at Western and help you bring that into the Bachelor of Applied Science with Healthcare Leadership and Administration. Tammy has been an excellent resource. She helps with the onboarding and admissions also, and she has been played a key pivotal role in our marketing and recruiting efforts as well. So that's just a little bit about our program. We would love to answer any questions that you may have about this program. And Tammy has posted the QR code. So if you're interested and you want to scan that for more information, you can also reach out to the HLA at winona.edu. And we've listed our website as well as our phone number too, that you can definitely reach out in any way that you feel comfortable. So maybe we'd like to open it up for any questions that you may have.
Everybody's going to be quiet now.
Don't be shy, and that's okay. Can't think of any questions at this time. We would welcome the opportunity to meet one-on-one with any of the students that are interested. And it could be, maybe you're interested in now. It could be, remember, 5 years from now, 10 years from now. Life has a way of changing, and you never know when you're going to be looking at making a change in your professional career. I always say your career will evolve and change as you do.
So this is Ashley. Can you hear me?
Yes.
Yes.
Okay. So I am interested in the bachelor's for sure, possibly the master's, but I don't think I could start this summer. My mom is really sick and I have some stuff I have to take care of. So if I waited till fall, that would be okay.
Absolutely. Yep. We have rolling admissions that you can start fall, spring, or summer. And so if you're interested, you might want to meet with one of our success coaches and just come up with a tentative plan, knowing that you'd want a fall start, and that's totally fine.
Okay, perfect.
Yeah, thank you.
Great question.
Yeah, and
Okay,
I know
well-
I do have a couple students that will actually be taking a couple courses this summer. And they're kind of looking at like, well, maybe I'm interested, but I can't start till fall because I'm technically not done yet. I'm like, that's okay. We'll get you set up. We'll get you connected. So.
Absolutely.
Yeah, we try to pride ourselves on meeting you where you're at. So wherever you're at, whether it's just getting done with your associate's degree, or maybe you've taken all your goal areas, maybe you need to take a 5-year gap and just work in healthcare for a while, that's totally fine.
And that experience will only, build your overall
Right.
experience in our program as well.
And one other thing I think of too is depending on where you end up working at, you want to really look at the tuition reimbursement that's offered through your place of employment, knowing that most hospitals have some type of an incentive as well. So we know that Mayo Health System does have a career investment program, and they also have a flexible program reimbursement option. Amplify in La Crosse does have a tuition reimbursement program as well. So if you're working at any of those hospitals or other hospitals, make sure that you reach out to human resources and they'd be able to inform you what kind of a tuition reimbursement incentive is available through that place of employment.
So I work at Gunderson now. I've been there for about 5 years. And I did use the tuition reimbursement. They make it very easy.
Fantastic.
Um, but I think so I'm already a scheduler there in cardio testing. And so as far as staying in my department with the associate's degree, I can't move up any further. I am where I am. I took this as a stepping stone
Sure.
to be able to move up further. So I think I think I would be interested for sure. So I'll get with Caitlin maybe and see what route would be the best to go.
Absolutely. And you're welcome to contact like Barb Nassick or Tammy Reed would be
Okay.
happy to meet with you too, just to take a
Yeah,
look at your
perfect.
transcripts and see what you need.
Okay. Sounds good. I'll write down their numbers quick.
Thank you, Ashley.
Yeah, thanks.
And
I've had
also,
a few other students reach out to Barb and Tammy, and I've only ever heard very positive things about both of you. So,
oh, thank you. That's so nice. We have a student in our program right now that I know was in your program, Caitlin. And
Mhm.
he would be happy to sit down with anybody who would like to talk to him about his experience.
Yeah, I won't say any names, but he does work at Gunderson right now. I just met with him last Thursday and he's like, I graduated May. And he's like, I'm just so ready. It's been so long. I'm like, okay, but really, you didn't graduate my program that long ago. Like, I know it feels like a long time when you're taking all the classes and you're doing all the things, but I'm like, give it like a year out of the program and you're going to realize how fast it all actually went. So.
And I'm pretty sure he's going to pursue his master's degree too.
He did say he's definitely looking into that. So I'm like, good. My first like guinea pig is like going the whole way with
Yes.
Winona. It's great.
We actually started this because of him, right? Because we saw that
Yeah.
there were so many classes that matched up so well. So,
Mhm. Yeah, and we've changed the curriculum a little bit, which Destiny and Ashley won't be, they're not finishing the program with the new curriculum. So a couple of the class names are going to be a little bit different from like what you guys show into what they actually took, but it's the same course overall. So don't let the course names throw you guys if you were questioning that.
no, we're ready for that. Okay, well, if nobody else has any questions, we can go ahead and close down the meeting. So it was really nice to chat with you all. We appreciate you taking your time out with us tonight. As Dr. Radke said, just reach out to us if you have any questions. If you are interested in applying, do not pay that application fee. All of our articulation partners application is always free to Winona State. And like I said, just reach out to us if you have any questions, any concerns, you want to just take a look at where you're at. That's what we're here for. So give us a call, send us an email, let us know what we can do to support you.
Caitlin, thank
Thank
you
you.
so much for taking time out of your busy schedule. We want to thank all the students for hopping on this recording today. We look forward to talking to as many of you that are interested as want to reach out.
Yes, thank you guys so much.